Good morning, everyone.
Good morning, and welcome to the BCDA Caregiver Support Programs mini conference. This theme of today's conference is Finding Balance in Caregiving. I'm your host, Kathleen Koenig-Stoffel. I am the Caregiver Support Manager, and my co-host today is Morgan Brown, who is one of our caregiver specialists.
Good morning,
So-
everyone.
We're so glad you found time today to join us. So how do you find balance? Is there a balance? Are you doing the right thing? These are important questions for our caregivers. They can dominate a caregiver's daily thoughts. And balance, as we know, is key to reducing stress, feeling more confident, and providing the best care for our loved ones, our friends, and neighbors. Balance is also really important for self-care as well. What steps can you take that will help you find balance in your caregiving? Today, we have a wonderful lineup of speakers who will be sharing their experience and their expertise on balance. They will present 30-minute tips on their topics. And we know your time is precious, and we want to make sure your time is honored. Our hope is that each and every one of you will leave with a new piece of information, a new strategy to try, or a new resource to use. Enjoy the day.
All right, good morning, everyone. Thank you, Kathleen, and thank you, everyone, for being with us today. I am Morgan Brown. I'd like to introduce Karen Sorensen, our first speaker. Karen is a certified care manager and national board certified health and wellness coach. Before beginning with the Option Group in 2023, Karen worked as a care coordinator and a care manager for a boutique home care agency in Baltimore. She enjoys working with clients and their family members to help older adults preserve independence and experience quality longevity. Having served as a family care manager and caregiver, she understands firsthand the challenges, commitment, and expense for caring for aging loved ones. So, welcome, Karen, and thank you for being with us today.
Thank you, and good morning, everyone. Let me share my screen. Okay. Can everyone see that, Morgan?
Yes, it's
Okay. Am I connected?
You're good.
Okay, great. Thank you. So on behalf of the Option Group, thank you to the Caregiver Support Program of the Baltimore County Department of Aging for inviting us to present today. Our topic is finding relationship balance through creating a care plan. We at the Option Group value working alongside family caregivers and care managers, and we understand that family caregivers really are the unsung heroes in our families, our communities, and our society worldwide. Today, I am presenting this topic on behalf of my colleague, Jackie Tangiers. She's sorry that she can't be here today. But ironically, she's serving her role as a family caregiver herself, and she's with a loved one at the hospital. So our thoughts are with her and her family. If you're not familiar with the Option Group, we are essentially private duty care management. Ellen Platt is pictured here. She is the founder of the Option Group. She has more than 30 years experience in care management, and she started the Option Group 11 years ago. The Option Group's team includes social workers, nurses, rehab counselors, and other health professionals. The Option Group serves Maryland, Delaware, and parts of Pennsylvania, mostly Philadelphia and southeastern Pennsylvania. All of the care managers at the Option Group are Aging Life Care Association members. If you're not familiar with ALCA, it is the professional organization for geriatric care managers, and they do have a directory on their website and other resources for family caregivers and care managers. Their website is aginglifecare.org. Lastly, the main office is in Hunt Valley, Maryland. Oops. Okay. What is a care plan? A care plan outlines your loved one's needs and various ways to meet them. It promotes better health, safety, and quality of life for older adults. A care plan can prevent caregiver burnout. Care plans differ from a plan of care, which is your loved one's doctor or medical, which is something that your loved one's medical team or doctor provides. A care plan, also known as a caregiving plan, helps you prepare for non-medical needs and arrange for support. A care plan should be centered around your loved one, his or her needs, and the support team. And well-designed care plans can avoid scheduling issues, improve communication, reduce stress, and that feeling of being overwhelmed. What should a care plan include? Because care plans are person-centric, they all vary and can include anything that's important to your person. But here are some important areas to consider. Your loved one's physical and mental health, their activities of daily living, and their instrumental activities of daily living, and we'll talk about those in a bit. Managing finances, insurance and legal matters, safety, and lifestyle. Your loved one's physical and mental health is so important, and that's generally where we start with our care plans. And we always ask questions, does your loved one have chronic health conditions, such as heart problems, high blood pressure, diabetes, arthritis, or dementia? Does your parent have depression, anxiety, psychosis, or another mental health problem? Do you think your loved one should get help from a mental health professional? And depending on your loved one's health, you may have to hire a professional for skilled nursing care. Can your loved one hear or see well? Sometimes that's not always a question we ask, but it's really, really important. Does your loved one require specialized care for wounds, catheters, or other medical devices? What prescriptions does your loved one take to manage these conditions? And does your loved one need reminders to take their medicines? Okay. Next is the activities of daily living. You may be familiar with this term, I'm sure you are, but the ADLs are the basic activities necessary for survival. So these include eating, bathing, dressing, toileting, continence, and mobility. And some of the questions you really want to ask are, does your loved one struggle with incontinence? How often? What time of day? Can your parent move about easily and safely? Can they navigate their environment? Does your parent need help with bathing, shaving, dressing, transferring, toileting, and other personal care activities? Does your parent have swallowing problems or other issues that make eating difficult? Next, we examine the instrumental activities of daily living, or the IADLs. And these are the more complex activities necessary for living independently. For example, can your loved one prepare a meal? Can they go grocery shopping? Can your loved one manage their medications? Can your loved one cook, manage light housekeeping or yard work or drive? Oh, sorry. Oops, I don't know what happened there. Um, There we go, sorry. Can your loved one seek assistance in an emergency? Can they call 911? Can your loved one use their phone? Do they use a computer or a tablet? And can they use a calendar? These questions we ask are about your loved one's ability to manage their finances. Can your loved one manage their finances without any help? Do they remember to pay their bills? What are your loved one's monthly income and expenses? Where does your loved one get their income? Does your loved one have a savings account? And if so, how long will it last? Where does your loved one save financial records such as their home, title, or insurance plan? Knowing where those are located is important. Many aspects of your loved one's care require close collaboration between family members, health providers, and legal professionals. Finding out if your loved one has long-term care, supplementary, or life insurance is important. Does their insurance plan cover the cost of non-medical care? What insurance does your loved one have, such as Medicare, Medicaid, or a private policy? And we like to collect, or we like to have their insurance cards or copies of them handy. Does your loved one's current plan cover medical exams or procedures that their doctor requested? Does your loved one have a will, a trust, estate plan, advance directive, or another plan? Has your family arranged a healthcare proxy or power of attorney? And lastly, just like the financial documents, can you and the caregiving team access these documents? Next, we always like to look in someone's home, evaluate the safety of their home. And as I'm sure everyone at this conference knows, keeping your older adults safe and comfortable is always a priority. All of us want independence, but we also have to make sure that our loved ones are safe. And some things to consider. Is your loved one's home free from clutter and fall hazards? If there are stairs, can your loved one use them safely? If your parent lives alone, can they call 911 quickly? Can they get out if there were a fire? That's another, question to ask. What degree of home and property maintenance does your loved one need? And should the home be evaluated by an occupational therapist or home modification expert? Is your loved one still driving? As family caregivers, we know that you are already actively participating in your loved one's emotional health just by being there. But it's also good to consider other items when developing an individualized care plan. What are your parents' hobbies? What are their interests? Is your loved one part of a religious organization? Does your parent engage in social activities or have people over to their home? Do other relatives live near your loved one? Is there someone from your loved one's religious organization who can help with transportation to services? Are they getting enough exercise? After we consider all of those areas, it's time to create a care plan, or what we also call a caregiving care plan. This section of the presentation will cover the following: identifying your loved one's needs, considering your situation, starting a dialogue, assembling a caregiving team, developing your plan, and executing your plan. Pinpointing your parents' primary needs is crucial to your caregiving care plan. The following questions can help you structure your thoughts. What level of care does your parent require? Will you be the primary caregiver? When will your loved one require help, and for how long? In other words, is this a temporary situation, such as a knee replacement, or is this going to be a long-term and is this going to be long-term and progressive, such as a dementia diagnosis? Will you need extra help from a professional caregiver? Will you need help from your family? Do you and your caregiving team have special skills, advanced education or training, or caregiver certifications to better meet your loved one's needs? Identifying the strengths of your team is so important. Next, it's time to really consider your situation. Before you take on the role of the family caregiver or care manager, there are questions you should ask yourself. Does your current schedule allow for the time commitment caregiving requires? What can you handle? What can the members of your immediate family handle? Your spouse or partner, your children? Will you be able to afford to care for your loved one financially? Whether you take time off or leave your job, or if you are expected to help pay for private duty care? Can you manage your parents' personal care, or will you need to hire a professional caregiver? And do you have a reliable support system? It's always best to involve your family as you create a caregiver care plan. They might offer helpful insights you may not have noticed, or even volunteer to help with some of the responsibilities. All families are different. Some people are very open about all aspects of their lives, while others insist on privacy. But communication is so important throughout this process. It truly is the foundation of better care. And because communication is the foundation of better care, you, your parent, and other family members must practice respectful and open communication. Of course, it may not be easy, especially when it comes to discussing challenging subjects, such as finances, your family dynamics and support, shifts in your loved one's health or well-being, mobility restrictions, the need for more specialized care, and end-of-life wishes. It's recommended to address these topics with your loved one first, if that's possible. And then after that, you can open it up and involve other family members in your discussions. Assembling a care team. A caregiving team is crucial to support you and your loved one. The extra support ensures your loved one's needs are consistently met, even when you're unavailable. It also gives you an opportunity for respite care when necessary. If possible, Your care team should designate one person for each area of your loved one's care. The major categories are finances, meals, grocery shopping, home maintenance, physician appointments, medication management, caregiving, both family and professional, transportation, and respite for family caregivers. This is where a discussion of each team member's strengths, abilities, and availability comes into play. Consider where each adult child lives, for example. If mom or dad is here in Maryland, what can out-of-state children handle? Assigning duties such as bill paying, arranging for home maintenance, or ordering meals, tasks that can be done from afar, is helpful. Local adult children will then be responsible for more hands-on care. Each person may not be responsible for every task that falls in their category, but you can ensure that each one is completed. Once you have a focused team and a reliable support system, you can move on to creating a care plan or a caregiving care plan. Not only should it account for your parents' needs, but it should also address anyone else involved in their care. And these are what we deem essential when creating a care plan. A good care plan should have the contact information of your loved one's medical providers, usually the name, location, phone numbers. Also, it's helpful to have the caregiving team's contact information handy in one place. A schedule of your loved one's care. Having a calendar is really such a great tool. Whether it's online or at the home is extremely helpful. I find that my older adult clients value their calendars so much. It gives them not only, it just gives them something to look forward to, it provides structure. And so I just, I just think calendars are really wonderful. It's great to keep everybody on track with what's going on. Your loved one's medication schedule and instructions. Critical medical information, such as the health conditions that we talked about before, and any allergies. And then assigned responsibilities, such as Claire does laundry on Wednesday afternoons, meal delivery Mondays through Fridays, family dinner on weekends, Rachel's responsible. And then also instructions for an emergency. Once you have a plan, it's time to implement it. Make sure everyone involved in your loved one's care has a copy and provide new versions whenever it's updated. In addition, you should routinely consult your loved one's caregiving team and check on your loved one. Then, as you receive new information about your loved one, including any changes, you can modify your plan so it continues to fit their needs. Remember that a care plan is supposed to make your role as the family caregiver or care manager easier. As you make revisions, don't forget to account for changes in your life and perhaps the lives of your caregiving team. If you or someone else can't manage the workload as well as you initially thought, or it starts interfering with your physical, mental, and emotional health, then assign the task to someone else. When designing, developing, and executing care plans, always make decisions with dignity, respect, and autonomy. Any person-centered care plan should honor the older adult. Dignity in this case is the right of a person to be valued for their own sake. Respect is regarding regard for the older adult's feelings, wishes, rights, and traditions. And autonomy is giving the older adult control of decision making, allowing them to be part of the care plan is really, really important. Here's an example of a caregiving support team. Pretty rough, but you can organize the material however you would like. But when I identify the support team, I usually highlight their name, with a color. I explain the person's responsibilities and also provide contact information. So in this example, you'll see John, who is the son of Lily, lives out of town, and so he's responsible for his mother's finances and bill paying. He lives in Florida, but he's available by phone and email, and he does visit once a month. So sometimes that's really helpful to know for any caregiver coming in to help care for Lily. Rachel is local. She's a nurse, and so she's her mother's healthcare POA. She visits twice a week, generally on Wednesdays and Saturdays, and she's been her mother's family caregiver since her mother's dementia diagnosis. And because she has special skills, she really does handle all the medication management and professional caregiver schedule. And she attends all of Lily's medical appointments with her. Here is an example, a caregiving care plan example of duties. This is just a sample of some of the major tasks when caring for an older adult. Kind of the big categories: meal preparation, money management, medication management, transportation, and scheduling and coordinating. It's great to have this all in one place, because if someone can't perform their duties one week, then someone else can take over. Again, you can set this up however you like. There's plenty of online products, which I'll get to soon. But you want to identify some of the recurring events up front. What is the structure of the week, of the month? Provide the resources, and then also include any contact information, because these items can be extremely helpful. So, for example, transportation. Under transportation, we see that Lily she attends Sunday Mass, and she goes to exercise class at the Y Monday, Wednesday, and Friday. So you could just provide those resources, provide a timeline, and then who's in charge, whether it's Rachel or a professional caregiver. The last two columns here are important. This is where the color coordination comes in handy. Each person knows what they are responsible for and when. And the last column here is for updates. As all of you know, when you're caring for a loved one, their lives can be very busy very quickly, especially if there are medical appointments, medication changes, and these items all have to be implemented. So it's ideal for everyone on the care team to be aware of what's changed. When I worked in home care, for example, there were a lot of times when the family care manager would take their loved one to the physician's office. Medication changes would be made, but that information didn't always get to the caregiver who is administering the medications. So it's really ideal for everyone on the care team to be aware of what's changed. And I can't emphasize enough communication here. Over communication, there's no harm in over communicating any of the any of the items when it comes to caring for a family member. But the other item here I'd like to mention, as a private duty care manager and also as a family care manager, I'm often asked to attend medical appointments. And when that happens, I am compelled to report what's happened, what medications changes were made, what the follow-up appointments are, what any significant findings were. And I provide these details to my client, of course, or to my client's healthcare power of attorney. For example, I take my in-laws to their doctor's appointments in the Philadelphia area regularly, but I always write up a summary for my sister-in-law, who is the healthcare power of attorney. She's not able to do it herself, but at least she has the information that she needs, should she need to step in or just to keep track of everything that's going on. And I encourage you to do the same. It's important, again, that everyone on the team is aware of what's going on, what's new, and what's changed. Here are some online resources and even some mobile apps. These are great tools that can create a care plan. They can keep family members and the care team connected. And they also have scheduling built in, which is really wonderful. So these are some valuable resources for you. Lots of Helping Hands is a popular one. It's a website and app to coordinate meals and the various areas of help from family and friends. Carely, it's care.ly. That's a free caregiving app to keep families and caregivers connected and organized. And then there's Caring Village, which is an online organizer for family caregiving teams. And these are great to just visit their websites, look at them. You may already be using them, you may have others, but it's nice to look around and see what's out there and see what's out there for free also. Thank you so much for being here and to learn more about finding balance. The work you do is truly a labor of love. We see every day the difference you make in the lives of older adults, and we honor you and thank you. And again, thank you to the Baltimore County Department of Aging for inviting us here today to present and for hosting this.
Thank you so much, Karen. Thank you so much for stepping in. That was wonderful. Everyone, if you have any questions, again, you can leave them in the chat. However, again, we will not be answering them until the end. So I'll give everyone a couple minutes to put their questions in the chat. Since we're a little behind, we want to respect everyone's time. We're going to go ahead and go into our next session on fall prevention. So if you still have questions, you can continue to put them in the chat, but I'm going to go ahead and introduce our next speaker, Kim Hai. Welcome. Kim Hai is a graduate of Towson University and has been an occupational therapist for over 30 years. She conducts home safety assessments for older adults living in Baltimore County. She provides support and assistance to those who wish to age in place in their homes. Today's presentation will focus on home safety, education on modifications, and tips and ways to prevent falls. My apologies. So welcome and thank you for being with us, Kim.
Thank you, Morgan, and thank you everyone for having me and being a part of this presentation. So as Morgan indicated, let me share my slides first of all. Sure, I can do that. Okay, where are you slides? Here we go. Okay, can you all see that okay? Great. Okay. So again, good morning, everyone, and thank you for having me. I'm happy to be here to share with you information on falls and as caregivers finding that balance in preventing falls. So the focus of my presentation will be on staying active and falls free with occupational therapy. So here's some information about myself, my contact information. And I want to begin by sharing with you the presentation and the goals for this presentation. So by the end of this presentation, you will be able to recognize that most falls among older adults results from interacting risk factors. And what that basically means is that most falls are caused by interaction of multiple risk factors. And certainly the more risk factors a person has, the greater his or her chances are of falling. You also will be able to describe how occupational therapy practitioners, such as myself, can help you to reduce your risk of falls and be able to identify strategies and resources that you can use to reduce your risk for falling. And certainly when we talk about, reducing your risk of falling, this not only includes those that you are caring for, but for you as the caregiver, that's important as well. So why do we fall and why do falls happen? So I want to read to you some data from the Center for Disease Control, the CDC. So about 36 million falls are reported among older adults each year. This results in more than 32,000 deaths. Each year, about 3 million older adults are treated in emergency departments for a fall injury. And 1 out of every 5 falls causes an injury such as broken bones or a head injury. So as you can see, falls are a huge problem. So when it comes to falls, they typically fall into 3 categories. And most falls are experienced by older adults. They result from those interacting risk factors that we talked about. And again, they fall into 3 general categories. So the first category is the physical risk factors, and these are changes in your body that increases your risk of falls. Some examples of physical risk factors could include weakness in your lower body, vitamin D deficiency or bone weakness, difficulty walking and balance, side effects from medications, which can be a huge problem, vision issues such as cataracts, glaucoma, macular degeneration, or a person could experience problems with their feet. Included in the behavioral risk factors, and again, these are things that we do or don't do that increases our fall risk, and typically these are related to poor decision making. This could be poor eating habits or lack of hydration, wearing inappropriate footwear, shoes that don't fit properly and don't provide good support, clothing that doesn't fit properly, and the environmental risk factors, and these are the hazards in our homes or in our community. An example of environmental risk factors are clutter, lack of stair railings, and this could be lack of stair railings inside or outside of the home, loose rugs, throw rugs, other tripping hazards, lack of grab bars in the bathroom, or poor lighting, especially on the stairs. So as you take a look at this scene here, I want you to think about what I just talked about in terms of those risk factors. When you look at this slide here, hopefully you can see it okay. What are some of the environmental risk factors or some of the behavioral risk factors that you can identify in this slide? So if you wouldn't mind putting your responses in the chat, and Morgan, if you can read those to me, if anybody has anything to say about this slide here.
Someone mentioned the stool,
Mm-hmm.
reaching, standing on the stool again.
Okay, so that's exactly right.
The
So
vacuum is in the way, standing in the fridge, items out of reach. Yeah, all good ones, all good
okay,
ones.
exactly. So you are exactly right if you mention any of those things. So certainly standing on a step stool, that's those risky behaviors that people partake in that they shouldn't do, which is a no-no. So if you do have to stand on something, you want to stand on something that you provide some support, a proper type of step stool that may have a handle to it. You certainly don't want to be reaching for things that are way out of your reach. You want to make some changes in the environment to place things that are, closer where you can reach them, maybe put them down on the counter. And certainly looking at that vacuum cleaner, if this person were to fall off the stool, certainly that's a tripping hazard that she's going to fall and crash right into that vacuum cleaner. So again, making those necessary changes in the environment, and think about those behaviors that you participate in that might be a risk for causing you to have a fall in your home. Okay, so thank you for those responses. So as caregivers, what can you do to help minimize the falls risk factors to keep you and your loved ones that you're caring for safe in the home? And we're going to discuss that a little bit more. And one of the things that you can do is consult with somebody like myself, an occupational therapist. So as occupational therapists, we work with all age groups from pediatrics to geriatrics and everything in between. Our primary focus is on ADLs, or those activities of daily living, and these are the things that people do in their everyday lives, such as bathing, dressing, hygiene, and grooming. And certainly the focus on daily activities to help people remain as independent and as safe as possible, despite any injury, illness, or disability that they may have. Very often people get confused by the term occupational therapist. I've had people think that, our goal and our purpose is to find someone to help them find them a job. But of course, occupational therapist, that's not what we're all about. The term occupation actually refers to a person's involvement in meaningful activities. And it's also, occupations are linked to important life roles and reflects our values and identities, and certainly caregiving is an example of that. So as mentioned earlier, occupational therapists, we work with people in all different types of age groups, and in a variety of settings. And those settings could be early learning, childcare settings, school settings, and certainly rehabilitation centers. You will definitely find occupational therapy in hospital-based programs, and also in community-based programs, such as your day programs or maybe a senior center, and certainly in the home. Now, occupational therapy is a team approach in terms of preventing falls. We work with other rehab professionals that you may be familiar with, and they include physical therapists and speech language pathologists. And again, the goal in mind is to work together as a team to keep you and your loved ones safe and helping to maintain their independence in their everyday activities. So the role of occupational therapy in fall prevention is that we want to teach people how to reduce the risk factors and certainly maintain a level of safety in doing the things that are certainly important to them. And also to provide training and education to our caregivers so that they can help their loved ones to reduce their risk of falls in the home. Also, occupational therapy practitioners work with people after a fall-related injury to help them to return to the things that they need and want to do. Now we're going to go into a case study and look at Terry, I'm sorry. Now Terry's story may sound very familiar to someone that you have had to provide care to. And as we're reading Terry's story, I want you to be mindful of those risk factors that we mentioned before, those three categories of risk factors: the physical, the behavioral, and the environmental risk factors. So let's read Terry's story. So Terry fell while carrying a lawn chair down the basement steps. He fractured his right wrist. Terry's doctor referred him to occupational therapy. So the occupational therapist completed an evaluation, and Kate, who was his therapist, and Terry, they worked together to create a plan to help him to continue doing his daily activities and to reduce his risk of falls in the future. Okay. So these are Terry's risk factors. His medications, and certainly medications can interact and create health problems that increase the risk of falls. So it's very important as caregivers to have an understanding of what the medications that the persons that you're caring for, what they're taking, and any potential side effects that can occur that can lead to falls. You certainly want to speak with the doctors about the medications and how that they make your loved ones feel, and so that they can make any adjustments in their medication. And certainly if things are interacting, or you want to be mindful to make sure that your loved one is taking their medication properly. And certainly staying hydrated is very important as well. So continue on with his risk factors, his physical risk factors. His vision, you want to make sure that your loved one has their vision checked on a regular basis. We mentioned some of those eye conditions such as glaucoma, cataracts, and macular degeneration, which can distort a person's vision and certainly put them at risk for falls. So if a cataract is developing, you certainly want to make sure that it may be a time for them to get their cataracts removed, make sure that they have, proper eyeglasses that are appropriate for them to see within their environment, and certainly make sure that the home has adequate lighting that is within their reach and appropriate lighting to light the path so that they're not walking around in a dark environment. And certainly making those necessary changes to keep the environment safe. The physical risk factors in terms of his balance, occupational therapists can help you with learning balance exercises and ways to build balance skills during your everyday activities that you have to perform. And certainly getting involved in a community-based exercise program for balance is certainly very important. And looking at this in some terms of the falls hazard in someone's home, Terry was going down the basement or to a lower level. You want to make sure that, as you see here, it looks kind of dark. It does appear that they have handrails, so you want to make sure that everything is in place and modifications are made so that you can keep your loved one and yourself safe as much as possible. The bathroom. The bathroom is one of those places that are notorious for falls because of the tub and people's ability to get in and out of a tub safely. So one of the things that occupational therapists can do, and one of the things that I do working here at the Department of Aging, is providing home safety assessment And through these evaluations, I am able to make those necessary recommendations on home modifications and any equipment that a person might need to promote independence. And recommend things such as grab bars, handheld shower hoses, tub chairs, transfer benches to make sure that a person stays safe as much as possible. Again, occupational therapists can help with problem solving and how to do things safely in order to maintain the person's ability to engage in those daily activities that are meaningful to them. So what alternative ways do you think Terry could have used to get that patio furniture inside without putting him at risk for a fall? So again, we want to take a moment to put in the chat and see if you can come up with some alternative ways or things that you probably would have done to make sure that you were safe if you had to get a piece of furniture or carry something in a safe manner. So let's take a moment and see if there are any suggestions that you may want to give.
Someone said just ask for help.
And that is the biggest thing. Ask for help. A lot of times people don't want to do that, but that's very important. Ask for the help when you need it. Certainly, someone else, I think.
Yep, same thing. Someone said ask for help or just get someone else to do it.
Correct. Those are the proper answers. Yes, get somebody else to do it, or if you had to do it yourself, find a way that's, if there's an interest on a lower level to get it in there, but certainly you do not want to carry things up and down stairs and you don't have the ability to do those things. So you want to make sure that you are picking activities that are good at a good match for your capabilities. Don't do things that you know you're not capable of, and don't ask and feel like you can't ask somebody for help. It's very important to ask for help. Okay. So in terms of summarizing Terry's occupational therapy program, the therapist probably focused on medication, and certainly this is the thing that you want to address with your loved one, making sure that there are no interactions with their medications, and consult with their doctor or a pharmacist to make sure that any medications that they're taking, that they're being taken properly and don't have, interactions that could relate to a fall. Balance and vision. Certainly you want to have these things addressed. If they look like they're having some mobility issues, you may want to consult with a physical therapist to see if there's a need for some type of assisted device to help them with ambulating, canes, walkers, rollators, etc. And certainly getting their vision checked having their vision checked on a regular basis is very important to address any issues relating to macular degeneration, glaucoma, and cataracts. Addressing those fall hazards in the home is certainly important. You want to make those necessary changes and modifications to make sure that the person is staying safe. And whatever your loved one is involved in terms of their valued roles and occupations, things that they enjoy, again, consulting with an occupational therapist to make sure that the person can still engage in those everyday activities that they enjoy. It just may mean that they have to do things in a different way, modify the way that they're doing things, again, so that they can stay engaged in all the things that are important to them. And look at those risky behaviors and addressing those fall prevention behaviors so that they're not engaging in things that certainly like Terry did with trying to take a chair down the steps, and it's not safe to do so. So be mindful of any type of behavior that you might observe in a person that you're caring for, to address those situations so that they're not putting themselves at risk. Okay, so as you can see here, what might you do? And you mentioned those things as far as Terry's situation of what he could do to make sure that he stayed safe. So do you have any other tips that you have done in the past to protect yourself or your loved one from having a fall? Some things that we may not have mentioned or covered. So if you want to, put in the chat anything that you have done to make sure that you keep a safe home environment for yourself and for the person that you may be caring for. So we'll take a minute and see if anybody has any recommendations or things that they want to share that they do to protect themselves and their loved ones.
So I see, sorry, there's a couple of people saying some different things. Added a walker with tray for moving items. I mentioned that I've seen people use gate belts before. Um, the next one is steps clear of items, where a fanny pack to put items in to carry around. Um, they also have those little trays or what are they called? Little bags that you could put maybe on a walker to, put stuff in
Walker
and
bags.
yes.
Mm-hmm.
Stair glide, check small furniture like a rolling office chair. Yep, adding the basket to the walker. We're all saying that at the same time, so
Excellent, excellent. All great suggestions and recommendations and things to consider. So as we summarize the strategies to reducing falls, managing those chronic illnesses or conditions is very important. As we mentioned before, getting eye exams regularly, staying hydrated, certainly talking to your physician and the pharmacist about medications, staying active and exercising regularly. Taking a stroll is something simple as that is a form of exercise that's cheap and easy to do and can be done anytime, and you can walk around in your house if the weather is bad. So just finding a way to engage in some form of exercise is so important. Finding alternatives to those potentially risky behaviors, as we mentioned in Terry's situation, don't try to perform tasks that you're not capable of doing, and certainly identifying and eliminating fall hazards in your homes. And I do highly recommend that people, there are many things online, checklists that you can do, and just take a moment to walk around your home to identify, different types of hazards in your home. Those checklists are very helpful, and certainly consulting with occupational therapists like myself to come out to do a home safety assessment. And that's something that I am able to do here at Baltimore County Department of Aging. There are a couple of programs, one program in particular that I do is called the BCAUS program, which stands for Baltimore County Age-Friendly Upgrades for Seniors. And that is our home safety home repair program where we work with a number of partner agencies to do home modifications and make changes to the homes to make sure that the person can stay safe. It is a program that you have to qualify for, so you can call into our MAP office and get some information. They can do a screening over the phone to see if you are eligible for the program. But if you find that you're not eligible for the program, again, myself as an occupational therapist, I can come out to assess the home environment, I'm sorry, to make any recommendations that are needed to keep your loved one and yourself safe at home, making recommendations such as, again, do they need equipment, a tub chair, shower chairs, grab bars, handheld shower hoses? We do have a loan closet here at the Baltimore County Department of Aging where we can provide you with some equipment. So if that's a need as well, certainly give our MAP office a call to find out the times that are available for you to see if any equipment that you might need. If you can't afford possibly to purchase something yourself, the loan closet is an available option for that. Okay. So in conclusion, we wanted to let you know that falls can be prevented. Falls can result in injuries such as hip fractures, broken bones, and head trauma. They carry an emotional toll, and after a fall, older people can start to become fearful of falling, limit their activities, resulting in further physical decline, social isolation, and depression. And certainly that's something that you don't want to have happen. As caregivers, you can also address the fear of falling, talk with your loved one and the person that you're caring for, check on them regularly to see if they're having any concerns, participate in appointments with them to make sure that they're communicating to their healthcare providers and discussing with their doctors any sensitive issues that they, don't feel comfortable bringing up. But if you're aware of it, that you can help them to get through that and talk to their healthcare provider. And certainly making that home environment safer as much as possible to prevent those falls from happening. So I thank you so much for the opportunity to speak with you on today. And if anyone has any questions, we can put those in the chat for later. But I honor all the caregivers and all that they do. So I know it's a tough job, been there myself, but keep up the good work and hang in there. And thank you so much for having me.
Thank you so much. That was wonderful. The interactive section was great. So thank you so much. Again, as Kim said, you can put your questions in the chat. I'll give everyone a couple minutes to write down their questions. And we will come back just in a couple minutes to get started on our raffle drawing within the next couple minutes.
And I see somebody, I'm gonna put my contact information in the chat.
Kathleen, you're muted right now.
That would help if I turn that on. So thanks again so much, Kim. That was great. Loved your energy and all the information was wonderful. As we're waiting for our Wheel of Names to come on board with Lynn McCamey, just want to go over a few things about our caregiver program. Excuse me. For those who are not aware of what all the services we provide. See if I can share my screen real quick. Let's see here. How's that looking, Morgan? Good? All right.
Sorry, I was muted. Yes, it looks good.
Okay. Okay, so we are funded by the National Family Caregiver Support Program to support a range of services and support to family caregivers and informal caregivers to care for their loved ones so that they're able to stay at home as long as possible. We serve adult family members or informal caregivers age 18 and older, providing care to individuals 60 years of age and older. Adult family members or other informal caregivers age 18 and older, providing care to individuals with Alzheimer's disease and related disorders. We also serve older relatives, not parents, age 55 and older, providing care to children under the age of 18. And many folks don't know about this aspect of service, but we do have that in place, as well as for older relatives, including parents, age 55 and older, caring for their adult children age 18 to 59 with disabilities. The 5 types of services we provide are information about available services, assistance to gain access to these services, one-to-one consultation that occurs one time. We also have respite care, financial support, and supplemental service financial support. Both of those are in the form of a stipend. We also provide education, training, and outreach. So we do have resource sessions that are available online and at our senior centers. Morgan will give more information at the end of this program with the dates and times. We have a quarterly caregiver newsletter that comes out, as well as an older relative newsletter that comes out annually. Folks can either subscribe online or call to subscribe. And we do educational programs such as this conference and our annual conference, as well as other daytime programs and trainings throughout the year. And those are offered in person or online. With eligibility for our stipends, must be age 16 over. The care recipient must live in Baltimore County. The caregiver does not. The care recipient must not be receiving hospice services because hospice has this benefit. And the care recipient requires an assistant with at least 2 activities of daily living, several of those that Kim had gone over with you. And it takes about 12 weeks or so to process if the funding is available. If not, we do provide a wait list. We support older relatives and grandparents with the stipend application and resources. We do work with senior centers to create intergenerational programming, and we're hoping to offer more in the coming year. Again, we create the once-a-year newsletter, Relatives Taking Care of Relatives, and we partner with the Department of Social Services Kinship Program. So we do have connecting information with them. Okay, so now I believe Lynn is ready. I would like to introduce Lynn McCabe, who is our BCDA Ombudsman Manager, and she's also representative and sister of the, I'm gonna get the name right, the Alpha Kappa Alpha Sorority Epsilon Omega Chapter. And I want to thank them for their generosity today. Did I say that right, Lynn?
You did.
I heard you laughing. Okay. And I want to thank them and Lynn for their time and their generosity today with the Wheel of Names and the gift card presentation.
Well, good morning, everybody. It looks like you've had a great presentation so far. I don't know if I can share my screen so everybody can see the Wheel of Names spinning. I should be able to.
You should be able to. See if you can, and if you can't, then just let me know. Oh, yep, it's coming up. Perfect.
Hey, let's make it large. All right, so this is an opportunity for everybody that's registered. Their name is in this lovely wheel. I'll spin it, and the person's name that comes up will win our gift basket. And this one is a Relax gift basket. So here we go. So Kathleen, what we will do is we'll make sure we have the correct contact information for Miss Linda Jones, and that will be mailed to her, and she'll be able to enjoy her lovely spa and relax gift pack.
All right, great. Thank you so much, Lynn.
You're welcome.
And Lynn will
Next one.
Lynn will return. I'm sorry. Lynn will return later this morning.
Okay. Bye-bye.
Bye-bye.
Thank you,
All
Lynn.
right. Next up, we have Damon Gaskew. Damon is a certified public accountant. chartered global management accountant and retired financial executive with over 45 years financial management experience. He assisted in managing several mid-size to large financial service companies that specialize in insurance and investment services. Welcome, Damon.
Oh, I'm just so happy to be here and learned a wealth of knowledge in the past half hour that I've been on. um, I'm going to come at you today a little differently. I'm going to come at you from the standpoint of being a former caregiver with my mother and my father-in-law. And now in retirement, I'm dealing as a caregiver with my wife. I retired 3 years ago, and right after I retired, we had all of these plans of traveling, and she had a mini stroke. And then last year in November, she had another mini stroke, and we had a scare this weekend where we had to rush her to the hospital because she was developing an episode at 1 o'clock in the morning. But she's doing fine. So I'm going to come at you from the standpoint as a caregiver and lessons learned. So let me share my screen. Let's see here. Okay. Bring it up. Why is this not working? Take a minute here. Okay. Oh, sorry, lost it there a minute. Bring it up. Takes a second to bring it up. Here we go. There we go. All right. Can everybody see my screen?
Yes.
Great, great, great. All right. I'm going to talk about developing a financial plan for caregivers. And like I said, I don't belong to any agency. I'm going to come at this from the standpoint of being a caregiver for my mother and my father-in-law, who's now, they've both gone on to, be with the Lord, and now dealing with it with my wife. So let's talk about the definition of a financial caregiver. That's someone who's entrusted that oversees a loved one, friend, or associate's finances while the person is unable to do it on their own. Let me tell you, often, and many of you may know, it's a daunting task. Where do you go for help? Especially if if you're not used to managing your own finances. It's mostly 80% behavioral change and 20% knowledge. Now, if you look at, any videos on financial management, they'll tell you that, it really only deals with 20% of knowledge, just have a minimum amount of knowledge, but it's really a behavioral change because, you're managing somebody else's finances, whether it's your parents, you have a sick child, your spouse, and you're thrusted into actually doing this day-to-day management of their finances because they're not able to do it. It's a daunting task. Additional work can put really a lot of stress on the family even if you're managing your own finances. So, I'm going to go step by step here. Where do I begin? And I'm going to talk to you about some of the things that helped me in the beginning. Now, I told you I'm a financial I was a financial executive. I'm a financial manager. My degrees are in accounting and finance. So, I have a financial background, and my parents were, good enough early on when their health started failing, to put me in charge over their finances. Not that I managed it day to day, but they put me on all of their accounts. I set up, power of attorney for them, to make it easy for me if they're not weren't able to manage their own finances. They were wise enough, to put that, as their health was failing, wise enough to put that in place early on. Now, I'm gonna tell you, I was one of 9 kids, and I was the first one to go to college. I was the first one to have a financial background. I had certifications, etc. So I don't know, out of all the siblings, and all of us have done relatively well, but my parents decided that they wanted me to be, the overseer of their finances. I guess they, and I've done that. I would do the right thing if something would happen where they weren't able to do it. Now, that put me in a precarious position because, you know, when they first did it, they said, Damon, don't tell the others. And I said, well, I don't know whether that's a good idea, but we know that you're going to do the right thing when the time comes. So we're entrusting you, to manage our finances. And I've done just that. I did just that. And I'm still managing, my parents' estate, but it is a daunting task. And, you got to get buy-in from your siblings or your relatives or whoever, because it could get really nasty when folks pass away. Um, so the first thing I did was establish a dual power of attorney. And what is a dual power of attorney? Many of you may already have one in place for your loved one, but it allows the person to act on your behalf if you're not capable to act for yourself, especially in unforeseen circumstances over a person's finances. Now, Maryland has, if you go out to www.marylandcourts.gov/power of attorney, they have examples of power of attorneys that for Maryland that are valid in Maryland. So you can take the ones that they have out there and modify it based on your situation. You really don't have to get an attorney to do it, but if you don't feel comfortable in doing that, I advise you to get an attorney. Now,
Freeman, could I
yeah.
ask you to put your slides on from the beginning on the slideshow so that we get out the full screen?
Oh, okay.
It's in that upper corner, right all the way over to the end. It
But
says from beginning.
I thought I
No,
had it on full screen. Okay.
it's
All
the
right.
upper top left corner.
The left corner.
It says from beginning, and then it's right below your cursor. Go straight down. It's next to from current. There you go. From beginning, and then from current slide.
Oh, I don't see that. Huh. I see arrows. Let's see.
It's under file and under home, and there's a
Can't
panel.
see you can't see my full slides on the screen?
No, we see all of them together in their normal mode, not in slideshow mode.
Okay,
There you, oh, well, we lost you. Okay. I got you.
lose me? Let's go back.
We have to do a drop down box underneath the standard
Okay.
file.
Let's see. Let me escape here. Okay. I'm sorry. I don't understand. Can you see it now?
No, we just see you. We actually lost the sharing.
Let me go down to the bottom here. All right. Let me get out of this. I apologize. The sharing is spinning here, so. Technology.
Would you like us to
Is it-
try to share your screen, your slides?
Yeah, would you do that, please? Because it says we can't display your shared content. Make sure that you're allowed permission to share content and then try again. And I gave permission.
There you go. Thank
Can
you.
you see? Oh, okay. Are you sharing your screen?
I am, yes, you're good to go. If you'll just let me know when you'd like me to advance the slides.
Okay, thank you. Let's go to the third slide, please. Okay, there. Okay, that's fine. All right, this is where I left off. I apologize. Um, this is the first time I've used WebEx. I'm used to using Zoom. Okay, where do you begin? And I talked about establishing a power of attorney. That's very important because that power of attorney allows you to deal with your loved ones, banks, um, credit card agencies, uh, hospitals, doctors, etc. So it's pretty important that you put this in place. Try to put this in place up front because it'll eliminate a lot of headaches. In addition, you know, and one of the things that was helpful for me with my parents is that they added me to their checking accounts. Now, I went and talked with their bank. I said, I'm not going to touch it unless something happens. So, I put it in place so that if something did happen, I was able to take over and write bills on their behalf. So that was very helpful when they became disabled and couldn't do it on their own. All right. So told you where you can go to get an example of a power of attorney. You can do it on your own, or else get an attorney or CPA. They can help you complete one for you based on your particular needs. Now, that said, is that you have to get permission from your loved one if they're in a position, to agree to have you as a power of attorney. All you do is complete the form as far as what you're willing to handle on their behalf, what they'd like for you to handle on their behalf, as far as their finances is concerned, and have it witnessed by two individuals, or they can be family members, or have a notary. That's always beneficial to have a notary do that. And you can go to a UPS store or some drugstores. They have notaries, and they can actually notarize it for you. But you have to be in their presence in order to sign the form and for them to notarize it. Okay, you can go out to Free Maryland POA. Stay on the screen, www.uslegalforms.com. And again, I just talked about it must be witnessed by two non-family member individuals or notarized by a notary. And then make multiple copies for banks, lenders, and doctor's office. Next slide, please. Okay, where do I begin step 2? Let's get organized. Again, gain by permission the patient's signature authority by adding name on the patient's checking account to pay needed expenses. That's the number 1 step. Even before you do the power of attorney, you can do this. Determine what income items are directly deposited in a checking or savings account for accessibility. Make deposits if income is received by check. Now, one of the challenges that I had, older adults, they have ways of managing their accounts, and some of them, they didn't have a financial background. So a lot of folks, I know my mother put a lot of her bills and stuff in a box. So I actually had to go through and organize it, based on dates and when things were due. Now she didn't have a lot of bills, and her house was paid for. But again, I had to go through, her monthly mail. I had to go through a checkbook, to see how she paid things, etc. When she got to the point where, she couldn't no longer do it on her own. We did the same thing for my father-in-law. In fact, he came to live with us after his wife died, and that was probably the best thing that could have happened, because he wasn't able to live on his own because his deceased wife, managed the household. She managed the household bill. So again, you know, going through going through and getting organized can be a daunting task also. Okay. Make deposits if income is received by check. Arrange bill payments by due dates to avoid delinquencies. Get online access of bank and investment accounts to watch for potential fraud. And that's important because, senior citizens these days, they're so subjective to, fraud. I can't tell you the number of calls we get. We get at least 2 spam calls a day. And, we have coverage on our phones, on our cell phones, on our home phones, but still somehow, they try to get through, and we don't answer, unless if we don't recognize the number, we let it go to voicemail. But I know one time um, we got a telephone call, and it was our own number, and I was confused, and I called upstairs to my wife, and I said, "Are you calling our own phone?" She said, "No." And I don't know how they did it, but they were trying to access us, through our own phone number. So fraud is out there, and they come at you in all kinds of ways, and you got to be careful. So one of the things that I recommend too is to, if you have access to your loved one's bank account and things of that sort, if you can, check it every day because you never know. Look at it every day. It puts more work on you, but I guarantee you, you got to be on your guard. Most importantly, get online access to the bank and investment accounts to watch for potential fraud. Also you want to get online access so that you may want to set up automatic payments and things of that sort to make it easy on you, so you don't have to worry about the monies that's going out on a monthly basis if you know what's coming in from a deposit standpoint. Pay estimated or actual tax payments if applicable. Next slide, please. So let's talk about establishing a monthly budget. Now, I don't know how many of you actually manage your own household, and I teach a course each semester. It's called "Where's Your Money?" And the first few sessions deals with developing a budget, and you would be surprised, how many folks don't do actual budgeting. From the standpoint of, knowing what's coming into their checking account and knowing what's going out. Most people that attend my class live from paycheck to paycheck. So we help get them organized. We provide a model that they can use, an electronic model that they can use, and we teach them how to use that model so they can go through on a monthly basis. Most of us know, how much income is coming in. That's pretty easy. If you're working, or if your loved one has Social Security or pension, most of that is fixed. Most of that doesn't change. So it's pretty easy to figure out the income. It's the expenses that you go searching for. Some things you might miss, you might not know about. They might be quarterly expenses that you haven't seen when you're going through the mail and things of that sort, or they might be semi-annual payments, things of that sort. So you really have to hone in on checking on what your loved one is responsible for as far as expenses are concerned. Sometimes you have to, call the bank, get old bank statements, go through those to see what kind of payments that are going out. So that'll help you kind of get organized as far as, what you're dealing with as far as the expense side of it is concerned, because that's the daunting part. The income side is pretty straightforward. especially if they're on fixed income and Social Security. Like I said, they may get a pension, or they may get payments out of their 401k plan and things of that sort. Most of that stuff is fixed. So it's pretty easy to kind of figure out the income that's coming in. However, it's the expenses that can be the way you can run into trouble, because if you miss a payment, those creditors are going to be calling, and you're going to spend a lot of time on the phone trying to explain what's going on. Some of them will work with you, but the patience runs out over time if you're trying to get organized and get things together. Group your expenses by your medical, the most important things that that need to be paid: your housing, your insurance, taxes. And one of the things I tell my students is automate the important. Those important expenses that that have to be paid on a monthly basis. If you can set up, if you go to your bank has all of these tools now. Most banks have these tools, budgeting tools online, where you can set up, the income that's coming in, the expenses. You can set them up automatically to be paid on an automatic basis. Make use of those resources. Now, we've heard a lot of speakers this morning, and I wish, when my mother had gotten ill, she had a stroke at my house, and we were kind of thrown into the fire, as far as taking care of it, because she became incapacitated for quite a long time. So so I was thrown into the fire of managing, her household expenses, because she lived alone, while she was incapacitated. And then after, she became better for a while, she came to live with me. So, and then I had to manage those household expenses. So I not only have to handle my household expenses, I had to handle my mother's household expenses, and I was working full time. So it was a very daunting task. And then my wife took over the management of her father. My mother-in-law passed away, and her father came to live with us, and so my wife, took over those managing those household expenses. We kept the house, but still he came to live with us because he couldn't live on his own. He started developing dementia, so he came to live with us. So it was it was we were managing a lot, and it was very stressful on, our personal household, but, we managed to get through it. And by the grace of God, we managed to get through it. But, I applaud the caregivers. You're like thrown into the fire. And you try to seek out these resources, but, they're not there with you day in and day out. So, they can give you encouragement. They can, give you tools to help you, but they're not there with you day in and day out when you have to deal with, the actual taking care of a loved one for as far as their finances is concerned. People are, a lot of people are afraid of dealing with finances. They are, and but it's when you get someone else's that you haven't been used to managing thrown on you, it is a daunting task. So you got to get into a routine, a rhythm, to manage it along with your own household expenses, income and expenses. All right. So one of the things you need to think about and managing those items is that I usually live by formulas. Income, you know, income minus expenses need to balance. If they equal zero, you're fine. When you're looking at your parents or your loved ones' expenses, whoever you're caregiving, even if it's a friend, that doesn't have any relatives that say, you've been my friend. If something happens to me, could you help manage my finances? Get the proper documents in place so you're able to do that. So, looking at this formula in the bullet point here, income minus expenses should come out to be zero. That means you have a balanced budget. If you have a deficit, you got to go back and figure out, where you have the shortfall and how you're going to manage that deficit on a month-to-month basis. If you have a surplus, put that money aside, because you're gonna need that money. You may need that money down the road to deal with future expenses dealing with your loved one. So if you have a deficit, determine where the shortfall will come from. A lot of times, and I remember, for my mother, she had some shortfalls, especially on the medication, before she went in a nursing home and things of that sort. So, some of that came out of my pocket. But, we'll talk a few minutes about, you really need to keep track of, if you pay out of your pocket for certain expenses for your loved one, you should keep track of that, because you can get help down the road to help you with, those shortfalls. If you have a surplus, again, as I mentioned, save for, put that money aside for future expenses. Next slide, please. And it's important, and I have several bullet points on this. The importance of documentation. If you haven't documented anything before, if you're taking care of a loved one, you need to document everything that you spend or income that comes in, document it, because it may come back, it's going to come back to haunt you at a later point in time, especially if they get to a point where they can't do anything on their own, or you have to put them into an assisted living home, etc. Really need to keep good documentation. And and I'll give you an example, and I'll talk about that in a few minutes, of something that happened to us. Um, um, again, one of the things, we had to move my mother into a nursing home because none of us, the family, couldn't take care of her. She stayed with me for a while, and she started developing dementia, and a nice, mild-mannered lady, became violent. We tried adult care centers, sent her to adult care centers, and my mother, here she was 5'4", really a nice, mild lady. And I don't know, dementia has a terrible way of dealing with, person's minds. And she took out the bus driver, with her cane. Then she got into, the adult sessions, with other, disabled folks. And, she got violent in that. So they kicked her out. I mean, they just couldn't handle it. So, we had folks from our church that help us. They came and stayed with her during the day because we worked during the day. Then it got to the point where, I had my father-in-law also, and my wife said, look, I think I'm going to stop work and, help take care of your mother and my father too. And I said, no, that's not your responsibility to take care of my mother. No, she wanted to do it. But, again, my mother stayed with us for, probably 6 months or so. And then she turned to my wife. And, I told her, I said to the family, I said, well, we have to put her somewhere to get, 24/7 care, because, I couldn't let her wreck my household. And I tell folks this story also too. When she stayed for us for a while, she would wake up in the middle of the night just screaming. And here I was at the time, I was a 50-year-old man, and the only way that I could get her to quiet during the night is I had to get in the bed and sleep with her, and it calmed her down. Now, here I was, a 50-year-old man, hadn't slept with my mom since I was 5 years old. But in order to keep her calm and keep the household calm, um, I had to go in and sleep with her. And when I went in, she slept like a baby. She didn't scream out loud or anything like that. But knowing that I was close, I was there, for her, help with the situation. Now, I don't know about, how many of you on the phone that have on the line that have experienced things like that, but it's a stressful time, dealing with not only the finances, but also dealing with the care of the loved one, especially when the terrible disease of dementia or Alzheimer's sets in. So, talk about documentation. Document to protect the caregiver if anything related to the patient is ever called into question, especially if you have siblings. It's best to keep documentation, especially if, you're in a Medicaid situation where you had to pay down all the assets of your patient or a loved one in order to move into a Medicaid situation to help pay for, ongoing expenses. But all of that's called into question that, you have to provide all that documentation. You have to provide, all of your loved ones' bank accounts and financial statements and things of that sort. It's really complicated. And one of the things that happened to us is that, I was helping to maintain my parents' house. and um and like I said, I was one of nine then. All of us were alive then, but it came to the point where, I went to my siblings. I said, I can't do this anymore. I said, I need help. And all of them looked at to me and they said, well, this is becoming a liability. We need to sell the house. Well, we had a life estate trust set up for on the house because um, my parents wanted all the kids' names on the house because when they passed away, they wanted the house to go to, all the kids. So I don't think that was a great idea, but that's what they wanted. And what happened was because she was in a nursing home, and I had a lawyer, and he didn't really realize this. We thought, if the names were on the house in this living trust for, more than 5 years, then the Medicare couldn't touch the house. Medicaid couldn't touch the house. But what we found out when we sold the house while she was still in a nursing home, still alive, the state came to us and said, "Oh no, you can't do that. You can't do that. You sold the house. A portion of those proceeds have to go to the nursing home." She was in a Medicaid situation. Medicaid was covering most of the expenses. We had drained her assets down to the minimum level as required by Medicaid. But then we sold her house. Although, her name, it was a living trust, you know, based on a certain formula, a portion of those proceeds had to go to the nursing home. So it was about a third of the proceeds, and the rest went to the kids. So what we did was, we paid the nursing home out of that, and then we put the rest of the money in trust until she passed away. But we learned this, and we were surprised the lawyer didn't know this. We had to go to a hearing and things of that sort. So it gets it's really, it puts a lot of stress on the family, as most of you probably know if you got siblings and things of that sort. Um, so again, document so you can provide a clear picture of the finances related to caring for your loved one, and also keep track of your own out of pocket expenses, because that's important too, because you can get reimbursed for those expenses. Next slide, please. So step 5, understand what is covered in patients' the healthcare policy if they're not on Medicare or Medicaid for home health care. A lot of Medicare doesn't cover, I think the rules are once you are, if you go into a facility, they'll pay for the first 100 days. Now, I think they'll pay 80%. If you have a Medicare supplement, the Medicare supplement policy will pick up to 20%. But they would only cover, if they have to go into a assisted living home, they would only cover 80% of that over 80 days. And after that, if you don't qualify for Medicaid, then you have to start paying down their assets if they have to remain in that facility. So I remember that happened to us, and this was back in 2006. I was paying something like close to $3,500 a month, for her care in a nursing home till we paid down her assets. And it's their money. It was there to help them, and that's what I explained to the family. So I told them, I said, look, hey, they worked hard all their lives, and now they're in a situation, she was in a situation where she needed her resources. So, although she wanted to leave resources to the family, we had to take care of her to make her life comfortable until, at which time she was able to come home or, passed away. So that's what we did. And again, understand Medicare and Medicaid requirements. Next slide, please. So here are the revelations. This is my last slide here. Again, if you have budget shortfalls, determine other options to cover caregivers' expenses for the patient, whether it comes from personal or other family resources. Explore options with a financial planner, banker, or attorney. I forgot to add accountant here. It could be an accountant that specializes in this kind of things and make sure they're a CPA, etc. Be transparent with managing expenses if other siblings are involved. Involve siblings, and I heard the other presenter talk about this. Involve siblings or other folks in your planning group, your care planning group, in the decision making process. That's very important to build that trust. And do not use any of the patient's funds for your own personal finances unless you have a written agreement to do so, because that can open up another can of worms. Next slide. So my last slide here is seek professional help. If your loved one needs long-term care, consider establishing a living trust or an adult guardianship. Get legal advice. Get legal advice. Get legal advice with understanding all the legal and financial ramifications effectively. And depending on the circumstances, assess whether financial planning is temporary or permanent and act accordingly. Next slide. And that's it for my presentation. And again, I told you guys I don't belong to any professional organization that gives caregiving support, but I wanted to share today, based on my own personal experience, and I know a lot of you have, gone through similar situations. And God bless you. Thank you for caring for that loved one, because they're humans, and again, if you're caring for a parent, and they would do the same for you if you were in that particular situation. So I want to thank the caregivers online. I want to thank you for your time today. Hopefully, I've encouraged someone today as far as being a caregiver and some of the things you need to deal with as far as their finances are concerned.
Thank you so much, Damon. And thank you, Ethel, for sharing the slides as well.
Yeah, thank you.
Great information.
Right.
All right.
I'll stick around for the questions and answers.
Great. So, like always, if you guys have any questions, please place them in the chat. We are going to move on to our last speaker. So, without further ado, Emily Kearns, welcome. Emily Kearns, PhD, MBA, is a coordinator for the community-based cross-sector initiative Dementia Friendly Baltimore County, led by the Baltimore County Department of Aging. Emily gives in-person and virtual dementia and brain health sessions throughout the Baltimore County community, including at senior centers, faith-based communities, staff trainings, and more. Emily's personal experience in caregiving with her parents, who both live with dementia, was life-changing, catapulting her into what is now her first love, supporting those living with dementia. Emily earned a doctorate in sociology from Boston College and an executive MBA from Northeastern University. So welcome, Emily, and thank you for being with us today.
Hi, Morgan. Hi, everyone. Thank you. It's an honor and a blessing to be here today. Can you hear me okay? Great. Thank you. So I am going to be speaking about brain health, and then at the very end, I'm going to be sharing some opportunities where you can join us to learn even more about dementia and brain health. So I am going to be sharing my screen, so let me start now. Okay, can you see my screen? Great, Morgan's nodding, thank you. So brain health is, the sessions uh, are permeating our entire society now from every corner. And you'll hear it referred to in different ways as cognitive well-being, brain health, and the Center for Disease Control, CDC, for example, is putting out brain health material. Alzheimer's Association certainly has wonderful brain health material. So what we are doing now in our dementia information sessions is starting to incorporate brain health. And why is that? Because as you just heard from Damon, caregiving, your caregiving, our caregiving is difficult as it is. If we are supporting as a care partner someone living with dementia and other cognitive challenges, it's even more difficult, and it's like a marathon. And what do we have to do in a marathon? We have to pace ourselves to maintain balance, which is the key theme today. And we also have to stop along for, if we want to use the running metaphor, at stations to get support, to get self-care. While there's no magic wand, right now there is no cure for the more than 100 diseases under the dementia umbrella, of which Alzheimer's is the most common. 70% of those living with dementia live with an Alzheimer's diagnosis. While there's no cure, and we are researching for that cure, there are things we can do. And so the glass is half full. And so oftentimes we get that question, give us hope. What can we do while we, as a society, are looking for a cure? Well, there's wonderful resources in the area of cognitive well-being and brain health, and that's what I'm using today to share with you. I am borrowing material from two key resources. One is called Keep Sharp, and that's in my slide, and you will actually get the slides later. Keep Sharp by Dr. Sanjay Gupta. Perhaps you know him. He's the CNN health correspondent on television. And also the Blue Zones Challenge, The Power of Nine by Dan Buettner. And that is based on National Geographic's funding of an important research project called Blue Zones. They went around the world trying to identify the communities with the most centurions, the people living over 100 years of age, to find the secret to longevity. And today I will incorporate Dr. Sanjay Gupta and Dan Buettner's advice to us. Now, I also want to say that what I'll be sharing with you is not only relevant to older folks. It's something that you perhaps should share at the dinner table with your adult children, with your grandchildren, because it's going to require a culture change and a change in our lifestyle, as you will see. There is some genetic component to Alzheimer's, but they say a very small percentage of dementia is related to genetics. The rest is related to lifestyle and our access to resources, or the jargon phrase is social determinants of health. But while that's sobering news, the good news is, as I said, there's something we can do to help prevent and help live meaningful lives even with a diagnosis. So let's go ahead then. I love this image of the brain. The brain as an organ is just so vibrant, and it helps us with all these different elements, right? It helps us with our exercise. It helps us with dancing here and movement. And these are important things that we need to continue to keep stimulating the brain. The good news is they're talking about neuroplasticity, which means, again, a big term here, jargon, but basically in accessible terms, it means that our brains continue to be stimulated and to evolve, to grow, and to potentially heal, to help us do all these wonderful things that are depicted here. Through our listening to music here, dancing and movement, exercise, meditation, and prayer, taking care of our health. So just remember this vibrant and exuberant image, I think. For me, it energizes me rather than depresses me. And that's where we want to be in this conversation. Is it not moving? Again, another image, a word cloud that I found online. They say that again, very overly simplistic, the top part of our brain helps us with our executive functions, our plannings, our organizing, managing details of the day. The bottom part of the brain helps us organize our feelings. A lot of the times, folks living with dementia, and again, it depends on the individual, but become incredibly sensitive and I would say emotionally intelligent. So our brain is an organ that is quite alive and vibrant and can change and evolve as we can all the way to the grave. So this is about taking care of this vibrant, exuberant organ that helps us live meaningful lives. So we're going to touch on some of these 10 ways that we can keep our brain healthy. And these include some that I think we already know about and we've heard about, includes our diet, our exercise, keeping hydrated, but some of them are new to us and we're going to focus especially on those like learning and staying staying connected. So why bother? Some people say, if there's no cure for dementia, why should we focus on brain health, on cognitive well-being? Well, these are some sobering statistics, and I want us all today as caregivers, care partners, we're caring for young people, we're caring for colleagues, caring for family members. I want us as caregivers, care partners in this world to pay attention. 30 to 40% of dementia caregivers or care partners suffer from both depression and emotional stress. And some research indicates that dementia care partners actually fall, get sick, often die before their loved ones with whom they're supporting, with whom they're caring. Why? Because of the terrible stress on their brain. So let's talk about why we should, take care and help reduce that stress. Research is indicating that the root cause of most disease, including dementias, is inflammation. And the root cause of inflammation is what? Stress. And we just heard from Damon, his experience, with his loved ones and the incredible stress. And I should add that I'm here in part because both of my parents lived and passed with dementia. And after 10 years of trying to support them in quite similar scenarios as Damon, selling the house, them having to move into a nursing home ultimately, me working full-time and supporting my single child. The stress was remarkable and I had no idea, even though I was in my 30s, young and supposedly vibrant. Only after 10 years of that marathon did I notice the stress, and now I know better the inflammation that it had on my life and my brain. So as I said, genetics plays only a minor role, so this is actually good news, isn't it? There is something that we can do if we're not predetermined to live with dementia. We talked about the social determinants of health, which is really key to our lifestyle. We need access and choice. And also I'm mentioning the intergenerational focus. Why do we need to share this PowerPoint and this conversation with our young people? They're finding that Alzheimer's disease, the most common of the diseases in the dementia umbrella, under the dementia umbrella, starts in the brain, affecting the brain 20 to 30 years before it shows up, before it manifests. So that means that my daughter, who's in her 30s, others in their 40s, are starting to, their brain is starting to register as either healthy or starting to become diseased. So when the young families, the sandwich generation who are taking care of their children and their older parents and grandparents, when they're getting stressed, that brain is responding in a way that will affect them as older individuals. So again, this is sobering news, but also an opportunity. As the Eastern cultures say, it's a crisis, but also an opportunity to intervene, to make sure we are making positive, healthy lifestyle choices so we can create and maintain, sustain a balanced life as caring people, as care partners. Another sobering statistic is why we should bother, related to this intergenerational focus, is that research is showing now that 45-plus-year-olds, folks in their 40s, are saying that they're experiencing what they're calling subjective cognitive decline, basically cognitive challenges, potentially early signs of dementia. This is defined, this subjective cognitive decline, as the worsening or more frequent confusion or memory loss. They're theorizing it's due to their stress. So let's move on to the action part of this PowerPoint, this conversation. In his book, Dr. Sanjay Gupta's book called Keep Sharp, and the companion book, which is a workbook called 12 Weeks to a Sharper You, and you'll have the reference at the end here, so you don't have to write anything down. You'll be receiving these, as I mentioned. He organizes his teachings, his research and his teachings on brain health in 6 pillars. He talks about nutrition, movement, and he talks about beyond exercise, which we'll mention in a minute. Downtime. Someone yesterday in a presentation said, downtime, what's that? And we all had a collective nervous laugh. Restorative sleep, discovery, and connection. So let's look at these each. So pillar 1, nutrition. We are what we eat. What's really interesting now is the research refers to our gut, our bellies, our stomach as our second brain. They have found that the human gut microbiome has healthy bacteria that we need to digest whatever we take in as food and to carry the healthy nutrients to our brain. So if we are eating in an unhealthy way, going back to that lifestyle choice, right? That is carried to our brain. So what they are recommending, both Sanjay Gupta and in the National Geographic research, the Blue Zones research, is that we focus on the Mediterranean style diet, which includes cold water fish such as salmon, plant proteins, whole grains. I think you've probably heard a lot of this. It's becoming quite mainstream now, which is exciting. Extra virgin oil, in other words, dropping the butter and margarine, nuts and seeds, fibrous whole fruits and vegetables. So the unhealthy diet that you perhaps are also hearing about is called SAD, and I love that an acronym, right? Very easy to remember. And unfortunately, that stands for the Standard American Diet, which is full of sugar, saturated fat, and trans fatty acids. Also, perhaps you've heard of the MIND diet, which is a combination of the Mediterranean that I just spoke of and this DASH diet intervention. I don't want to go into, especially given the time today, the deep dive, but you can get those books. You can also come to one of our sessions, our brain health sessions, and I'll give you my contact information later, or perhaps Morgan, you can put it in the email. But this combination of the Mediterranean and the DASH diet, and DASH stands for Dietary Approaches to Stop Hypertension, because hypertension, by the way, and diabetes are shown to potentially lead to dementia and sometimes are comorbid, so existing simultaneously with dementia. But when we combine the Mediterranean and the DASH approach, we are better, we're working toward a healthier brain. And again, what do you see here, this combination? We see the same mantra: green leafy vegetables, nuts, berries, fish, olive oil, dropping the red meat, right? Avoiding red and processed meat, butter and stick margarine, cheeses, pastries, sweets, fried, and fast food. Really difficult for me, I know. And this is not meant to guilt trip us at all. And this is what I love about Dr. Sanjay Gupta's book. I heard him speak, and we'll get to it in a minute, but he is not asking us to make radical changes. He's asking us to make small modifications, and we'll talk in a minute. So here, he talks about the SHARP principle. I love this. He says we must be realistic. We cannot, wave a magic wand and expect our lives to change and suddenly we're all vegan, right? Avoiding meat and dairy altogether. But he says, he invites us to create a framework that works for you, for each of us. He says, don't be rigid. Try to do the inner work of dropping the shame, reframe that inner critic, the voices that haunt all of us about what we're eating. Look at food as a source of pleasure and focus on nourishing versus dieting. And I think this is really important. And this is where I like the concept of well-being and balance. So of course, every now and then, if we have an ice cream cone or we have extra maple syrup, which is my favorite, on my waffles, that's not going to, create disease in our brain. It's really in the day-to-day diet that we maintain that our brain will stay, become and sustain healthiness. So what is his sharp principle that we can start working on in this non-rigid way, accessible way, where we make, changes in baby steps? So S stands for slashing the sugar and salt. Now, if we're eating out, which is really difficult to do because it's so expensive nowadays, so the only good news behind that, not eating out, is that when we cook at home, we're taking in less sugar and salt. Also to hydrate smartly. And there's a lot of research now on, keeping water handy throughout the day. For me, I drink coffee throughout the day. I have to really be careful because coffee actually dehydrates us. Adding omega-3 fatty acids from dietary sources. So there's a lot of talk about taking supplements, and there's mixed research on the supplements, but he's saying get it from our food as much as possible. Reduce our portions. In America, our portions are huge. One of the things I've started to try to practice is when I get a plate, if I am eating out, I put half of it in a takeout box. Sometimes, of course, I dip back into that takeout box in my one sitting, but invariably I'm finding that my one meal can actually be 2, sometimes 3 meals. They're so large, the portions. Not so if you travel overseas, the portions are usually smaller. And plan ahead. Try to keep healthy foods at home. I love this picture again, a vibrant, image. I'm a visual learner and my memory, really relies on visuals. So I hope you like this and it's helpful to you. You see the berries and the veggies, the salmon, and you see a little bit of chocolate. And they also say a little bit of wine is actually okay. Another way to think about it, again, you'll get this. They have this depiction representing the same kinds of things, fatty fish, and also some of the spices, turmeric, fermented foods, walnuts. Okay, what is the second pillar? So I'm going to move pretty quickly through these. Again, you can get the book. You can also reach back to me for fuller conversation. I love the second pillar in Dr. Sanjay Gupta's book because he says, you don't have to get a membership to a gym. He talks about movement in general being good for the body and the brain. He says aerobic exercise and anaerobic. So walking is good for the heart, but also anaerobic is a strength training that's really important for our bones and our muscles. And we just heard earlier from Kim Hai about falls prevention. We need to keep up with the strength training. But one of the things he does in the deeper dive in his book is he says that extra rigorous exercise, like, running an awful lot, it's really good for the heart. He says, but actually it's not so good for the brain, which is really fascinating. It actually inhibits one of the key proteins that our brains needs to stay healthy. So what does that mean? Excuse me, when I heard him speak, he said, every day take a brisk walk and with a friend and talk about your problems. Now, isn't that remarkable? I think most of us can do that. I try to do it at lunch, not always successfully. So I talked about the brain being, plastic or having plasticity, being able to increase, repair and maintain brain cells. And during movement, it actually increases productivity and alertness. And this is the protein that I referred to that is sometimes inhibited by too rigorous activity, BDNF, brain-derived neurotropic factor. You don't have to remember that, just an important protein. All right, pillar 3, downtime. This is separate from sleeping. He says, and this is so hard in our culture, how many of us, if we were in person, I'd ask us to talk about this a little bit, but how many of us are able to just sit and do nothing without feeling guilty? This past Sunday when it was rainy, I just thought, I just want to curl up in bed with a good book, nothing related to work or self-care, anything, just some silly novel. And I felt badly. I felt guilty about it. There must be something that I must do on my to-do list. And I'm sure you may experience this as well. But our culture encourages us to multitask and to constantly produce. He said over time, especially by the time we're older adults, this can really wear down our nervous system and impact our brain in a negative way. Also, there's a lot of research on trauma, which means anything that overwhelms us. As mammals, just like mammals out in the wild, if we are overwhelmed, instinctively to survive, we go into fight, flight, or freeze mode. Now that gets us through a lot, including caregiving. We always have to be hyper vigilant, right? Because we're caring for the safety of the other person as well as our own. Hypervigilance. We are on adrenaline and we are activated 24/7, aren't we? What happens, especially in the world of dementia, over 5, 10 years, is that fight, flight, freeze mode, that constant activation impacts our brain and our whole nervous system. So there's some work, I'll give a plug now for somatic experiencing, started by Dr. Peter Levine, that provides exercises and practices and counseling around healing that and integrating the trauma, whatever has overwhelmed us. Again, by the time we're older individuals, we are walking warriors, aren't we? We have survived and we've done it well for the most part because we've held and managed the stress. But as caregivers, we're increasingly compromised. So we need the downtime. Okay, practices to reduce the stress, excuse me. Think about meditation, think about prayer, think about music. There's a lot of wonderful research. There's a great evidence-based program called Music and Memory. If we listen to our favorite playlist, it really has a positive impact on the brain. Practice deep breathing with a long exhale. They're saying the long exhale with noise, like vroo, can actually help calm our nervous system. It activates the vagus nerve, the largest nerve in our system. And that vagus nerve connects our brain to the rest of our body. So if we're driving and we're activated in the Baltimore County, Baltimore City area, we are often activated driving, right? We can do that deep breath and that long exhale. Restorative sleep, pillar 4. We only have 2 more pillars after this, and then we'll stop and Morgan will take questions. Restorative sleep, the research is showing we need 7 to 9 hours of sleep. Isn't that amazing? When we sleep, our brains actually clean the gunk. This is simplifying it way. Cleans our brain and the stress. Now, we don't need to get it, they say in his book, in one session in one night. We can actually take power naps through the day. And we know this works pretty well for doctors, for example, who are in training as residents. They can't get 7 to 9 hours sleep. But most of us cannot, especially new parents, but especially caregivers, care partners with their older parents. The parents are up. As Damon said, he had to sleep with his mother who kept waking. We need the sleep. But 2/3 of the world, according to research, are chronically sleep deprived. What is the result of inadequate sleep? Risk for dementia, depression, mood disorders, heart disease. Believe it or not, it is related to weight gain, falls, immune dysfunction, and having a negative perspective. If we're constantly stressed and in that fight, flight, or freeze mode, we are not positive energy. We are fighting from our reptilian. We are surviving from our reptilian part of the brain, the brain that is so basic like an animal. We are feral, and I'm sure you and I have both been in those feral states. So prioritize sleep. Seriously, when I learned this, I quit my high stress job, decided that I wasn't going to be the A-type personality anymore because why? I feared dementia. Both of my folks lived with it. I saw it up close. I prioritized sleep. It's still very hard. Many of us as older folks wake up at 3 or 4 in the morning. We must go to those practices of relaxation, meditation, prayer, whatever works. The 5th pillar, discovery. I love this pillar. He says we must emphasize for our brain's health, the brain's sake, lifelong learning. He says doing our crossword puzzles, our Wordle, that's okay, but if we've been doing it a long time, our brain is not stretching. Our synapses are not firing. They're not creating new connections. Quite literally, our brain needs to keep learning until we're in the grave. So for me, unfortunately for my family and my friends and my neighbors, I'm learning the fiddle. I'm learning the violin. It's painful. I will never be able to play for someone else. But you know why I do it? Again, because I want a healthy brain. It really stretches me. He's talking about learning new languages or even simple things. If we brush our teeth with our right hands, try doing it with our left hands. Try doing something new. And if we watch our toddler grandchildren or those in the neighborhood, we see that they're constantly experimenting, and he is asking us to do the same. He says that we also need potentially to work longer, stay active. And the sobering news is in the US, we're going to have to. The good news is it has a positive function in our lives. It will help us stay connected, helps our brain remain active. I'm going to skip the next few here. He also talks about other ways to keep learning. If we're not working, we can volunteer. And goodness knows we're all needed in the society. The young children need us in the schools, parks and recreation. The animals need us in rescue shelters. So one of the things they found in blue zones that contributes to longevity is having a sense of purpose. This Okinawan woman, I love this, it's translated, said, "Every morning I know I'm loved and expected to love." She's 104, I believe, and she volunteers at a daycare center. So he said, find new hobbies, find new ways of giving back. It will give us a sense of purpose, and it's actually physiologically healthy for us and our brains. The last one I'll speak about is connection. Social contact, interdependence, asking for help, and you've heard about it with the other presenters. We must be interdependent. Our mantra in our culture is to be dependent, and I think we've got it wrong. I remember my mother wanted to be independent, so she refused to use her walker. Sure enough, she fell, broke her hip, and she had to use a wheelchair for the rest of her life. Had she accepted that she was interdependent on technology, such as a walker and others, she would have been more independent. So isn't that an irony? And there's research on social isolation that's really sobering. Living alone doesn't necessarily mean we're isolated, especially now with the technology for the virtual. And it also doesn't mean necessarily that we're lonely. We could actually live in a big household and feel isolated and lonely. But if we're living with a sense of isolation and loneliness, it can shorten our life more than smoking or diabetes. Isn't that amazing? So we really have to work on maintaining our friendships. It's very, very hard to do that, but that's where work and volunteering and finding new hobbies. A great theorist in the world of sociology wrote a book called Bowling Alone, and he says that we must join our interest groups. And this is where faith communities also comes in. We must have good relationships, and as Sanjay Gupta said, good relationships protect us, period. So I'm going to skip the blue zones piece because a lot of it is the same, or it corroborates, what Dr. Sanjay Gupta is saying, but you will get these. And I also invite you to get the book, both available from independent bookstores and also on Amazon. And I'm going to look at the resource pages, you'll see the list that I've been referring to. You'll also see some websites that you can go to. For example, you can go to the Administration for Community Living, and they have basics around brain health and aging. You can also go to the Dementia Society of America, which is a remarkable organization, and they have a free guide about brain health through their Project Brain Health. Again, the Alzheimer's Association has Healthy Brain Initiative, and the links are here, along with the CDC. And I want you to think about joining us. So I am housed in the Caregiver program that Kathleen described in the beginning. I am at the Department of Aging. I am full-time. And as Morgan said when she introduced me, I go around the community, and also other folks who are trained presenters called Dementia Friends Champions. These Dementia Champions give 1.5 sessions about dementia and now brain health. We go to faith communities. We can go to your fitness center. We're starting at the library. By the way, sidebar, we just started a new program through the Towson Public Library called Dementia Dialogues. And that is on the first Tuesday of every month from 2 to 3. You can reach out to me or the library and register. And that is a conversation, all things dementia, and all are welcome. Those living with dementia, those living with cognitive challenges, care partners. Well, you can also join us for the first Tuesday of every month for another program. Noon to 1:15, we talk about, again, dementia and brain health. Here's my contact information, dementiafriendly@baltimorecounty.gov. And I want to show you the flyers that you will get in this presentation. This invites you to the presentations that I just spoke about. And if you have an idea where we can come in your community to give a presentation, please reach out to us. This is the Dementia Friends, Dementia Information Sessions. We also have funded 4 grantees to do creative engagement programs. So the first three are memory cafes. These are for those living with dementia, cognitive challenges, and care partners. You can reach out to us for this flyer, but one is at the mosque, at the Golden Village, the Islamic Society of Baltimore, on the second Wednesday of every month. The second one is at the Talmar Horticultural Center. They meet in a greenhouse, absolutely beautiful. Third Friday of every month. Third one is at the Pikesville Senior Center, and then they are moving to a new site in July, so reach out to us for that. Third Tuesday of every month. And finally, we have a nature engagement series for those living with cognitive challenges and care partners at the Well for the Journey in Lutherville. So I will stop there and turn it back to Kathleen and Morgan. And thank you for all you do, and thank you for showing up for dementia.
Thank you so much, Emily. Great as always. And so now we can, we're a little bit early, but if we wanted to start on the second raffle, if Lynn was available to do that, we can. In the meantime, everyone can leave their questions for Emily in the chat, and we will get started on our Q&A shortly.
Linda will be back on at 11:45.
Okay, great.
All right, we can probably get started with the Q&A, and then when that is finished, then we will proceed with the final prize drawing.
Okay, great. So we're going to start from the beginning with our first presenter, Karen. Karen, can you hear us?
I can. Can you hear me?
Yep, great. Okay.
Okay, great.
So the first question we had was, what do you think about Sage Health for older adults? It's a newer boutique medical plan.
Oh, I have to be very honest, I don't know that plan.
Okay.
So I'm so sorry.
No problem at all. Okay. The next question that we had was, how do you get a person to realize that they are no longer capable of doing some tasks?
And that was for Kim, I believe.
Oh, I apologize.
Or, I mean, Karen can answer that one as well. But it was
It's a great question. I think that, goodness, I believe it was Emily who just talked about her mother who refused to use a walker and then had a broken hip. And unfortunately you know, there are people like that. I have family members like that who do resist care. I think the only advice I would say is back to communication, always opening dialogue, always opening with, you know, having that conversation, being as respectful as possible, showing your concern for a family member. You know, driving, for example, is another one of those issues. Using a walker is a big one, and then driving and being safe, either by not driving, having someone drive you, putting others at risk. It's just they're all really big issues, and I think that the best way to talk about them is to just talk about them. Sometimes if the conversation's going poorly, I do back off and then bring it up another time when the person might be a little more receptive. I hope that answers your question. Sometimes I will actually bring it up with a physician. If the person isn't going to hear me, then sometimes hearing it from someone else, perhaps a physician, is very helpful.
Kim, do you have any insight
And
that you'd like to share?
and just to pick up from where Karen mentioned, definitely hearing it from somebody else, if they're not ready to hear it from you, that's so important. And bringing, someone like myself in to, do those evaluation and assessments to kind of identify some of the issues that, they don't want to face. But again, hearing it from somebody else can be very helpful. So hopefully that answers the question.
Thank you. There's another question for you, Kim. Do you need a referral to have an OT professional come to the home?
So in my role at the Baltimore County Department of Aging, no, you do not. So I don't do anything considered like skilled hands-on type therapy services. So if that be the case, you would need a doctor's referral. But for me, I'm just going in to assess the environment and make recommendations on how to change the environment to make it safe. So no, you do not need a referral per se from a doctor, but just get in contact with either myself or call our map office, and they can get the information over to me. And I don't have the number for map offhand. Well, maybe I do. The map office is 410-887-2594. So that's another way you can kind of see if it's appropriate just for me, or you want to consider the home repair program that I mentioned. They can do a screening as well to see if I can just come out or if other services are needed as well.
Great. I think we might have missed one, maybe. Someone asked, what was the eligibility upgrades program?
That's the BCAUS program that I mentioned, the Baltimore County Age-Friendly Upgrades for Seniors. That's our home repair, home safety program, where that is the program where you have to meet some eligibility requirements in terms of income. You do have to be a Baltimore County resident. And we do work with 4 other partner agencies to go out to make the repairs on the homes. And those things could include repairs on like a roof repair, or putting up a ramp, or other modifications to keep someone safe in the home. So again, calling the MAP office for them to do a screening, go through the screening process, and to connect you with one of our community outreach workers if you do qualify for that particular program. But again, if you need any additional information, want to speak to me directly, you can reach out to me.
I'm putting the map information in the chat, as well as that's the Maryland Access Point. Folks who do not know that acronym.
Oh, okay. The next question, this was for Kim as well. Do you have a referral for the Department of Aging OT in the Harford County area? And then someone followed up with Howard County, so I would assume that they're looking for Harford and Howard County.
So I do know in Howard County, they do have an OT, and they do have some programs similar to Baltimore County. Harford County, I'm not as familiar with, but I know each county, along with Baltimore City, has a Department of Aging. So you may have to kind of Google or let your fingers do the walking, and so reach out to directly to those areas to see if they have any programs similar to what I'm speaking about. So that would be my best advice for that.
Great. Thank you. Thank you. And Kathleen did put the map information in the chat. Someone was asking about BCDA resources. So if you contact the map office, map will be able to get you to the correct program that you're looking for any resources. So thank you, Kim. I think that was the last question that we had for you.
Okay.
And now moving on to Damon. Someone said, I did not know a CPA can do power of attorney. How can a child convince a parent to be added to bank accounts? It has been a battle not seeing anything. I need a care plan ASAP.
Well, getting back to what was just mentioned, you got kind of have to build that trust. In my situation, my parents, recognized early on, and because of my financial background, I didn't have any problem in doing that. I didn't have any problem in doing that with my in-laws because, because I had the financial background, they trusted me, and, they wanted me to be a power of attorney along with my wife. Yeah, it's a tough situation. Building that trust is really tough, and it takes time. Maybe you can get some advice from a pastor or some other person that your loved one trust, but it's really tough. I wish I had a straight answer I could give to say, well, you do this and this will happen. Sometimes if the parent or loved one, is, mentally challenged, you may have to intervene legally from that standpoint. But it's tough to build that trust. And in addition to that, I think I saw a question related to, how do you get in a caregiving situation? How do you build trust with your siblings? And in my point, by me being a financial person, I used to have family meetings. I had the financials laid out, went over everything, but they still didn't trust me. And it's not like I was, taking any of the resources because I was in the position that I really didn't need to do that. I was more of a help than I was a hindrance as far as that's concerned. But it's trying to build that trust even from your siblings, especially when you. And I'm the type of person that I communicate, I think, pretty well, and I was trying to do that with my siblings, but it was tough. It was always this idea in the back of their mind that I was taking something from the parents. They have this money that that's going to belong to me if they pass away, and I want my share. But yet, they weren't volunteering to put up anything to help me, take care of them. Over and above, what resources they had in order to take care of them while I was the caregiver.
Okay, thank you. All right, so do you, let's see, or the panel know of Medicare covers assisted living and rehab? That's for anyone on the panel.
Well, I know it covers, if you're in the hospital, if you put in the hospital in medical care, and it'll cover the first 100 days, but not at 100%. I think it's at 80%, and then you need a supplemental plan in order to cover the 20%, or else you have to pay out of your pocket. Um, so, and after that 100 days, then you're gonna have to pay out of your pocket. So we live. I'm a pet peeve about this. We live in a society where we had the best healthcare system in the world, but yet when you get to a certain age and if you have to move into an assisted living or full-time nursing home and things of that sort, it's you have to pay down your resources. And it's something that I preach that young people should start planning for that type of stuff. We plan for a birth. We should plan for our mortality, and we should also plan if we would have to go into an assisted living home, in the future. Now, there's insurance policies that can cover that, and they came into being probably back in the late '80s. Long-term care policies that will pay, if you have to go into a nursing home, that will pay a certain dollar amount for a number of years to help you with paying those expenses if you get into a out of pocket position. But it's really tough, and I feel for these caregivers because not only it's a struggle to take care of a loved one, dealing with all of the ramifications around taking care of that loved one is daunting.
Great, thank you.
And Kathleen, I just like to add, of course, rehab is covered under Medicare, but again, like Damon said, is usually at 80%, and it covers rehab in all different types of settings, nursing homes, assisted livings, home care, and it would require usually a referral from a physician.
Great, thank you, Kim. I wanted to let the folks know, a person asked about Baltimore City resources. Yes, we have a community resource book that comes out yearly. that's put out by the county, but also within that resource, there are elements of like a city equivalent for that service. We also, there's a number for the Baltimore City Family Caregiver Support Program, and I just put that in the chat for anyone who's interested. Each county does have caregiver support program. There's also in the chat about Howard County as well. And the Baltimore County Department of Aging also has a wonderful SHIP program, which helps individuals navigate the Medicare system. So we can put that in the chat as well. All right, Morgan, do we have any other questions before we move on with Lynn?
Nope, there's no last minute ones that that came in. So I will go ahead and put the ship number in the chat, and in the meantime, we can go ahead with our last raffle.
Hello, everybody. All good stuff I'm hearing here. Really good information. So I'm going to share my screen again. And it'll come up. Just move this out of the way. All right, we're going to give it a spin. So Miss Kathy will be getting her movie pack, and I'm sure I'll get the address to send that out. On behalf of Alpha Kappa Alpha Sorority, Upsilon Epsilon Omega Baltimore County Graduate Chapter, we thank you for allowing us to participate and hope that everybody will enjoy not only the day, but the two winners, their gifts as well. Thank you again, Miss Kathleen.
Thank you, Lynn. Thank you so much for being here. Thank you for the generosity of sorority. We really appreciate this added addition to our conferences. It really brightens the day, and especially for those who receive the gifts in the mail.
Okay, have a good afternoon.
Take care. Before we end today, just want to go over some of the caregiving upcoming events with the Caregiver Support Program.
Thank you for sharing that, Ethel. So some of the upcoming events that we have a caregiver resource session earlier in the conference. Kathleen briefly went over a PowerPoint that we review with our caregivers in the community. We have a lot more that we offer within the caregiver support program. So at our caregiver resource sessions, if you see on the screen, we do them at the senior centers or we do them virtually. So the next one we have is Tuesday, May 21st from 10 to 11 a.m. at the Addie's Senior Center that is located in Dundalk. Or if you would prefer to do online, we have Wednesday, May 29th from 2:30 to 3:15 p.m. Again, that is virtual. And after that, we have one on Monday, June 10th from 11 a.m. to 12 p.m. at Lansdowne Senior Center. So the numbers that you see listed, you would call those numbers, which is directly to the Senior Center to be registered for those events. If it's online, you can contact 410-887-4724, or I can put the phone number and the email in the chat. You can let the Caregiver Support Program know for the virtual and we'll register you that way. Some of our daytime presentations. Monday, May 13th, up and coming from 11 a.m. to noon, we are going to have a presentation on assistive technology that will be done virtual with one of our MAP specialists within Baltimore County. On Monday, June 3rd from 11 a.m. to noon, we are going to be talking about aphasia, tips and resources, and that will be done virtually. On Tuesday, June 18th from 1 to 2 p.m., we're going to discuss unique caregiving challenges in the Black community, which will be done virtually. And then on Monday, June 24th, we're going to be doing Dementia Live from 1 to 2. That is in person at Victory Villa Senior Center. So if you guys have any questions, comments, or concerns about any of the upcoming events, again, you can call our main number, which I will put in the chat now.
We also have our annual conference coming up in November, on November 14th at the Parkville Senior Center. So stay tuned for more information about that wonderful in-person event. And that will be most likely from 9 to 3 p.m. And it's entitled, You Have a Voice, Navigating Difficult Conversations in Caregiving. So I just want to thank everyone so much for being here today. And thank you for all you do for your loved ones, friends, neighbors, relatives. I want to thank all of our wonderful speakers for spending their morning with us, presenting wonderful tips and resources. I want to thank my caregiving team that's on the screen right now. It's myself as manager. We have, of course, Morgan as a caregiver specialist for education and outreach. Kendra Jones, our office assistant, Sharon Rose, who works with individuals for consultations, and Emily Kearns, who you heard from today, who is our brilliant dementia-friendly coordinator. I want to thank Lynn again for joining us and providing and facilitating the prize raffle. Thank you to our wonderful and supportive communication team led by Ethel Rasmussen, who helped with marketing our conference, helped with registration, and helped with tech support today. Last but not least, again, supporting our team for our creative caregiving team for creating and facilitating today's conference. And again, I hope you all have a wonderful day. I hope you were able to take away some information and some resources that can help you find balance in your caregiving. Have a great afternoon.
Thank you, everyone.
Thank you.
Thank you. Bye.